Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon, founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very interesting topic, one that I think is highly shareable and one that's even borderline controversial and one that I think is going to stimulate a lot of conversations and comments at the end of the video. And I want you to watch it all the way through, because what I'm going to do is I'm going to talk to you about 3 anti-aging procedures that may actually be aging you. And you need to know this, and you need to share this with your friends and family and anyone who might benefit from this, because the intention of anything that's in the anti-aging category is to make you look younger and to defy aging. But what if those very procedures are actually accelerating aging and damaging the tissues? Wouldn't you want to know? I would. And I can tell you that what I'm about to share with you is an evolution of thinking that has been, I would say, sharpening its focus over the last probably 10 years. And this is through observation of not only my own relationships and experiences with the procedures that I'm sharing with you, but also from the countless stories that I've heard from my patients and prospective patients and people who just reached out to me asking for help on this very topic. And I'll share some of those stories as we go along. But ironically, literally just today, I had 2 patients that I had consultations with give me an entire discussion, background story that directly relates to what we're talking about today. Personal experiences that are basically what I'm going to share with you just now. And these were patients who were seeking surgical treatments with me. All right, folks. So 3 anti-aging treatments that are actually aging you. I'm going to start with number 1. Number 1 is energy devices. So what are energy devices? Energy devices are the type of devices that are basically putting external energy into the tissues through the skin in hopes of tightening and lifting. What are some common ones? Well, common ones are things like Ultherapy. You've all heard of Ultherapy. You've heard of thermage. You've heard of radiofrequency microneedling, and a big one is Morpheus 8. Now, there's dozens of other companies that have devices that, I won't go through and list them one by one, but basically those are the very common terms that are used out there, common names, very popular, good marketing around them. And the specific hope and goal is that these particular treatments function as a replacement or an opportunity to delay surgery. A replacement for facelifts or an opportunity to delay facelifts. So they've been around for a while, at least 10, 15, in some cases 20 years. There's been variations of these that have come on and come off the market. But here's the story behind them. Years ago, when this all started to become more and more popular, I started getting consultation requests for fat transfer and different types of things, specifically because the patient had gone in and had Ultherapy or had thermage or had Morpheus 8, and the response of their tissue was that they felt that they actually got more gaunt, that their face dropped, they lost volume, they felt like suddenly they were more fatigued, tired looking, etc. When I first started hearing about this, I thought, man, these are just one-offs. These are kind of like weird, patients are just not happy with their experiences. They have a relationship with the practitioners, or something is kind of off. Maybe there's something weird about the relationship going on here that might be causing these patients to be unhappy, because I didn't understand how those 2 things could relate to one another. Over the years, there was increasing numbers of people complaining that they went in for Ultherapy, they went in for Morpheus 8, etc. And as a result of a series or 1 or 2, whatever, they suddenly felt that they actually looked older. And they were obviously upset by this. They were, sometimes younger patients in their late 30s or early 40s, etc. And, with anything, once you start hearing something more and more and more, where there's smoke, there's often fire. And it took a little bit of time for me to really start to kind of put 2 and 2 together and understand what might be happening. And keep in mind that I actually never brought any of those devices into my office. And I should say this because, like I do with anything, I'm kind of a late adopter to devices and technology, etc. I like to know that something works before I start to advocate it for my patients. This has always been my policy since day one. No matter how much money it will make my practice, no matter how many patients want it, etc. If it doesn't clearly work, I'm not going to bring it in and potentially upset somebody because of a lack of expectations being met. So there was a period of time after maybe 4 or 5 years of, for example, therapy being on the market, I took it upon myself to start asking around colleagues all over the country, people who had no skin in the game with me, they weren't in my local markets, and just get an honest opinion. Every single one of them, straight down, said no, this stuff doesn't really work. It's kind of pointless, but patients want a non-surgical alternative, and this is what we have, so we offer it to patients. So I never got one. But what I should say about this is that when I started to learn about the technology and what's actually happening, and this is what happens, you're taking energy from external and you're passing it through the skin, and you're trying to tighten up the fascia. Well, where is the fascia related to the skin? Basically goes the surface of the skin, then you get into the middle of the skin, then you get into a layer called the subcutaneous fat. Then you get into the fascia. So as you're putting energy from the skin and you're going through the skin to the subcutaneous fat in hopes of getting to the fascia to tighten it and therefore lift, guess what you're doing to that fat? You're heating it and shrinking it, and putting energy into fat is like melting butter. It doesn't work right. And what ends up happening is that precious subcutaneous fat that really is part of, when you look at a baby and they have that kind of plump, supple look to them, it's because they're loaded with subcutaneous fat. As we age, we begin to lose subcutaneous fat. In fact, the progression of subcutaneous fat loss is why so many women specifically love their faces in their mid-30s, because they kind of melted away a lot of that baby fat that they had in their late teens and early 20s. Now they have a little bit more of a sophisticated look, or a little bit more chiseled and contoured, but they still don't look gaunt. They just have a little bit more definition in their cheekbones in these areas. So the favorite age for a lot of people when you ask is somewhere in their 30s, when a lot of that early subcutaneous fat melted. Now, the continuation of the loss of subcutaneous fat continues to go on for decades, and it gets to a point where actually you begin to lose more than you'd like, and now the face all of a sudden looks gaunt and hollowed out and all that kind of stuff. Now, when you are using energy devices that is pounding that energy through your tissues, effectively like a microwave, effectively damaging that precious subcutaneous fat, you are accelerating the aging process. Now, nothing sounds worse to me. I mean, why in the world would anyone undergo a treatment that has the risks and consequences of aging us, and in exchange, you don't even get fascial tightening? I mean, if you talk to people who've had these treatments done, especially if they're more mature in the aging process, like I'm talking like late 40s, early 50s, they really don't see any changes. I mean, it really doesn't do anything to lift or tighten the face. So at the end of the day, you're gaining nothing. And this observation and realization needs to be put in the forefront. If you're considering these things, really, really take note of them. And again, let's open this up to discussion. Flood the comments with your own experiences. I've done this exercise on my Instagram, and you would be blown away with the type of comments that people have. But again, like I said, I mean, maybe I'm just being biased because I'm seeing patients coming in to see me for surgical things, right? I don't think so. It doesn't make physiological sense. Now, let's talk about number 2. Number 2 is lasers, right? Now, listen, I'm not poo-pooing lasers. I'm not a negative on lasers, but here's the thing I will say. If you're using lasers to effectively tighten your face, prevent aging of the actual face, you're going down the wrong road. And here's why. Lasers are designed to treat skin changes. Please, please, please don't confuse the two. Don't get the wires crossed and think that by doing something to your skin, you're going to keep your face from sagging. Sagging is at the fascial level. It's a much deeper phenomenon. When you're using lasers and you're going in and you're getting fraxels and you're getting halos and you're doing, resurfacing and all this other stuff over and over and over and over again, you're basically pounding your skin, you're burning your skin. Doesn't make a ton of sense. There's nothing physiologically positive about getting tons of heat and deep repair of your skin happening over and over again. Now, having said that, your intention might be to keep your skin from sagging, but please keep in mind that skin sagging is a consequence of fascial sagging. Now, if you don't believe me, what happens to a pregnant woman? What happens to somebody who gains a lot of weight? Well, the deep tissue, in the case of pregnancy, the placenta with the baby inside of it, expands. What happens to the skin? The skin expands with it. What happens when the baby is born and the placenta shrinks and is removed? What happens then? Well, the stomach starts to shrink back and the skin begins to come back to a certain point. After pregnancy, there's always going to be potentially, in some cases, a little bit of excess. That's why people get abdominoplasties and different things like that. But my point though is that it's the underlying tissue that is dictating what happens to the skin. So putting heat repetitively on the surface of the skin is not tightening the deep problem. The deep problem is fascial laxity that happens because of a hormonal trigger that usually happens right around perimenopause and menopause, where estrogen levels drop and then the fascia starts to unravel and starts to loosen, and that's where jowls and neck laxity and all that kind of stuff. So if you're trying to use lasers to tighten up your face, you're basically gonna get nowhere with that. But repetitively doing that for your skin, not only is it gonna cost you a pretty penny, because these things are not cheap, but you're also fundamentally really overloading your skin with heat and laser and damage that is just not necessarily gonna manifest, not even gonna manifest into great looking skin per se. And we've all seen these people's skin who've had full field resurfacing, and their skin almost looks plastic. It has like a whiteness to it. It almost looks like artificial skin. That's damaged skin. That's not good, supple, young-looking skin. Deep resurfacing, repetitive resurfacing isn't wonderful for the skin. Just keep that in mind. You gotta use lasers as tools. If you've got some brown pigment, you wanna use an IPL or BBL to remove them, do so. But this leads to my other point. What are you gonna do once you remove them? Then you have to suppress the production of the pigment from forming. This is where skincare comes in. Folks, I'm gonna make it very simple and make it very, very understandable. If you want great skin, there's really 3 things you need to focus on. Number 1, be obsessive about sun protection. Nothing accelerates your skin aging more than sun. You don't believe me? There's studies, 80%, 90%, some quote, 70 to 90% very commonly quoted as the responsible sort of impacting factor for skin aging. What is skin aging? Fine lines and wrinkles, discolorations, dullness, thinning, all that type of stuff. That's all collagen loss and everything else that comes along with it. So sun protection is huge. The second aspect that's really, really important to that is the use of daily actives. Daily actives are like things like retinols, vitamin C, niacinamide, growth factors, things that are gonna stimulate collagen production, because that's at the forefront, and gonna suppress melanin production, which is pigmentation. Basically, this is the foundation of this concept of active, is really the entire reason I decided to start Karam MD Skin and develop the trifecta, because I wanted everything that I just mentioned plus a bunch more to be in the trifecta. Now you can get these things separately, of course, but my point is you have to use them regularly. And that's one of the benefits of using a system like that, is that it's 3 steps and it's easy to go. But if you don't do it that way, then the third point that I wanted to make is consistency is the key. What happens if you go to the gym for a few months and then you stop going? Well, everything you gained over that few months, you're gonna lose, right? Same thing goes with skin. If you're obsessive about sun protection and you're using daily actives, but then you do it for a few months and then you stop, you're gonna go back. You gotta make this a commitment forever. And if you do it forever, you'll be just like these patients that I see on a regular basis that are literally like in their 60s and 70s and have supple, beautiful skin. And if you ask them, what have you done your whole life? The answer is always the same: sun protection and the use of active ingredients like retin A and retinols and all this other stuff. So keep that in mind. That is an absolute key piece to skin. You don't need to do constant lasers, overdo your skin and potentially damage the skin that way. All right, folks, now this brings me to number 3. Number 3 is fillers. All right, so I already explained how the face ages, right? Fascia starts to get loose. The shape of the face goes from a youthful upside down triangle to more of a square as everything kind of drops down. You get sagging of the jowls, you get laxity of the neck, everything goes here. Now, for years, nearly 20 years, people have been trying to put filler into the face to fundamentally reinflate it. In fact, I remember there was this whole paradigm about, the face ages like it goes from a grape to a raisin. It's just a deflationary problem. So just pack it with a bunch of volume and you go back to being a grape. Well, that's not at all true. What ends up happening is, yes, we do lose volume in specific areas, but those are not the areas that people normally put filler in. And the areas that people normally put filler in to lift the face actually make us look older. And let me explain where those areas are. So people love to put it into the cheeks. Outer cheek here to kind of like try to remember, we said the triangular effect is really youthful. Well, it's youthful to an extent. It's youthful because in youth, the jawline is narrow and this area is relatively wider than the jawline. But with aging, this is all coming down. So now this is pretty long and wide and square. And by putting stuff out here, you're just making the cheeks look basically skeletonized, right? And where do you actually lose volume? You lose volume in your temples, you lose volume above your eyes, underneath your eyes. So by putting a bunch of volume in your cheek, when you have this other area of volume loss, like in these areas and these are, now all of a sudden your face looks skeletonized. What's a skeletonized face normally? It's an aged face. It's an older looking face that has lost volume, etc. So putting it into the cheekbones doesn't do the trick. In fact, it makes you look. Now, here's the other area where people love to put filler to try to correct sagging jowls. You put it in the jawline. People pack fillers into this angle of the mandible, they put it into the pre-jowl area. And remember, this is all come down. This is what aging is. It's a heaviness of the lower part of the face. So by putting more volume there, you're actually adding volume to an area that already has become excessively volumized because of sagging soft tissue. And now you make your face look older, heavier at the bottom, wider up top, more skeletonized, and you've just basically aged another 5 or 10 years. Thinking that all those thousands of dollars you're putting in with filler is gonna somehow lift the face and keep you from needing surgery, you've just kind of like shot yourself in the foot and you've gone backwards. And keep in mind as well, fillers do not completely go away. Folks, we have always been told 6 months, 9 months, the filler is gonna be gone and you gotta keep this process up, every 6 to 9 months. These fillers have been shown with MRI study after MRI study and just, personal experiences and looking at patients who've had fillers in their face for 5 or 10 years, the stuff sticks around and it changes the foundation of the face forever. So if you've already done this, the cat's out of the bag, it is what it is. Don't do it anymore. But if you're distraught about it and upset about it, unfortunately, this is kind of the nature of what happens in these things. I really don't have any great answers for. Removing fillers with enzymes and things like that can actually create more problems to the contours of the face and the ups and downs and all this it's a mess to try to remove it. Simple thing is, if you happen to be hearing this early in your filling stages, please keep this in heart and mind. It's not going to address what you're hoping. And it took us a long time. It took us 15, 20 years to recognize that adding fillers doesn't actually make us look younger. It just makes us look puffier and different. And the fact that it doesn't go away is an unfortunate consequence of all that. But it took us a minute to understand that. So to summarize, number 1, radiofrequency devices melt precious subcutaneous fat. Repeated laser after laser after laser on the surface of the skin is damaging the tissues and damaging the skin. Not a good thing to do. When it comes to fillers, there's areas, as I mentioned, temples, under eyes, above eyes, around here. Those are areas that lose a little volume. Maybe a little bit of filler in those areas can soften. But if you've got laxity, folks, if you have laxity, trust me, don't even bother putting in fillers into your face. It's not gonna do anything. In fact, I don't even do fat transfers on patients who have any laxity. Those fat transfers are for like 30-something-year-olds who have some genetic volume loss or early stages of volume loss. But I do fat transfer in addition to a vertical restore, for example, because I'm totally rejuvenating the face. I put the fascia back where it was, I lift everything up surgically, and then I add volume in the areas that have lost volume. And many of you have had a chance to see these before and afters. We'll just show you some right here. But this is what actual rejuvenation looks like. This is what you want ultimately, is to look totally natural and to look younger. You want to look the way you feel. You want to look like a younger version of yourself, because in your mind, you still are that person. So keep this in mind. Trust me by this. These points that I'm making are not just my opinion. This is becoming more and more talked about among patients, etc. And I'm looking forward to seeing the comments that you guys drop here as well. All right, folks, I hope you enjoyed this topic. Like I said, it's something I'm very passionate about, something that I feel it's important to share. You know, we keep everything very, very real with you folks. It's a wonderful community that we're forming here. And like I said, any questions you have, drop them in the comments below. If you haven't already, you're watching this for the first time, I've got tons of videos like this that come out every single week. So hit subscribe so you can get access to it, and hit your notification button so you get to know when these arrive. And if you enjoyed it, hit like, comment below, and more importantly, share it with others so people learn. If you like this type of topic, make sure you sign up for our Karam MD Skin newsletter, which we put out tons of beautiful educational material that'll help you navigate this very complicated and convoluted aesthetic and cosmetic landscape and make good decisions through empowerment and knowledge. All right, folks, thank you so much. Dr. Amir Karam.